I'm Chris Lansford, ENT surgeon.
I'm Dr. Jeff Sparks. I'm an otolaryngologist.
I've been in practice for 27 years now. I'm an ear, nose, and throat surgeon.
Working with surgeons for the past 16 years.
I'm an area sales manager for a medical device company.
I am a private practice otolaryngologist, so I spent a lot of time doing outpatient surgical sinus issues and sinus surgeries.
There's a lot of sinus procedures that are done in the office that are very uncomfortable.
The devices they're using today, they're larger and more cumbersome.
When we're doing sinus surgery, it's in a very small area.
We are always operating with two hands.
I always hold the scope with my left hand, and then I'm doing basically one-handed surgery with my right hand.
Frustrations with access and visibility.
A few drops of blood, it fills up that area. And so we're doing a suction in one hand and a scope in the other, and we don't even get to use our instrument.
They're constantly switching instrumentation. From that perspective, efficiency's not great.
All the cords are the issue, right? And so you have to have everything connected.
And the scope that I used, it's a rigid scope in one spot, and the head barely rotates.
You can't see around corners, and you certainly cannot reach around corners.
When you get deep into the nose, you may be working up past your scope. Some things we'll do sort of blindly, which nobody wants to hear that.
It's really remarkable. I think the potential is massive.
I feel that it's revolutionary.
This is what I would consider as disruptive technology.
It's going to make sinus care, more effective for our patients.
I've only seen it today, but already I'm thinking of different things that I could see it being used as. This could decrease the amount of instruments we have in the same space.
You do not need a large, heavy, bulky, power-hungry screen that you normally would use.
It's very easy, very portable.
Wireless HDMI.
Small, lightweight, easy to use.
It's actually more efficient for the physician as well. It puts the scope and the working instrument together in one hand.
This is actually a flexible scope that's smaller than my traditional scope.
But with the scope's flexibility, it makes it very easy to just use it as one instrument in one hand.
The two things are on top of each other, so it's much more comfortable for the patient.
This allows you to actually look and operate with both hands at the same time, where you could retract and dissect, or retract, cauterize, and cut, which you couldn't do before.
It's almost like growing a third arm.
Definitely gets me to places that are not easily seen.
You can get into the spaces easier, and then you can turn it so many different directions.
You can go 90 up to 120 and even 180.
I, in just a few minutes, was able to get into the sphenoid sinus, into the maxillary sinus, and up into the frontal sinus with a camera while doing a complete ethmoidectomy.
I think this opens up a whole realm of different ways of doing something that's less invasive for the patient and also actually much more effective.
Big fan. Big fan.
Thank you, guys.
Thank you.